Hello, this is Dr. David Green, Education Director for Premier Pain Specialists. Today's topic is avoiding surgery for degenerative disc disease. The normal intervertebral disc contains 80% water and 20% collagens and other proteins. The analogy is to that of a jelly donut with the harder outer covering called the annulus fibrosus, which does have nerve endings, okay, and then the inner jelly, which is called the nucleus pulposus. The disc serves as an excellent shock absorber as we walk, jump, twist, bend. Water is pushed out as shock is absorbed, and then it draws back in. When you start to get degenerative disc disease, what's basically happening is that the disc is losing water content. Okay, you start to lose height. So here's a healthy disc. Here's a disc that's degenerating, losing height, bulging out. All right, you can get pain from cracks and tears in the outer disc called the annulus. Okay, 40% of the time the intervertebral disc is the cause of low back pain. This can lead to inflammation and irritation of adjacent nerve roots. So not only can you get back pain, you can also get sciatica. Degenerative disc disease can lead to daily disabling pain, or it may cause no pain at all. There's been studies looking at MRIs of people who were asymptomatic with no back pain, and 35% between 20 and 50 have degenerative disc disease and are asymptomatic. So you could have an MRI look something like this or worse. This is called black disc disease, degenerative disc disease, and might not have any pain. Treatment options may include over-the-counter medications such as anti-inflammatories and Tylenol. For acute exacerbations, narcotics may be indicated, topical prescription pain creams, and then muscle relaxers. Physical therapy can also help. Chiropractic treatment can be very beneficial. TENS units, which are about the size of an iPod, they go on your belt. They have foam pads that go over the low back that emit slight electrical impulses through them, and they can change the way the brain perceives pain signals. This is spinal decompression therapy. It's computerized intermittent traction. It's been shown to be over 80% effective for pain relief of degenerative disc disease. Acupuncture can also be beneficial. When it comes to interventional treatments, trigger point injections can help for any spasms being incurred. Intradiscal treatment, which is where the needle goes into the disc, and studies have shown that can provide months at a time of pain relief. What's injected is typically steroid, but we'll get into a moment about regenerative medicine. A lot of times when you have degenerative disc disease, the facet joints in the back of the spine are causing pain from all the stresses that they're seeing. So treatments may include medial branch blocks, direct facet injections, and if those work and then wear off, a person can go on to have a radiofrequency ablation, which can provide excellent pain relief for up to 2 years. Epidural injections can be beneficial if adjacent nerve roots are being irritated. One treatment that's not really used much anymore is adept, intradiscal electrothermal treatment. Insurance companies stopped paying for it after studies kept showing that it didn't work. And then a mild procedure is minimally invasive lumbar discectomy or lumbar decompression. And that treatment is actually very helpful, and it's non-operative and outpatient. Here's a radiofrequency ablation. You can see this is in the low back, and then you have these little nerve endings coming out and providing sensation to these joints, here, here. So when you deaden those with a radiofrequency ablation, there's no motor function, it's only sensory. So you're taking away the sensation to the joint and providing excellent pain relief for, like I said, up to 2 years. Interventional treatments with stem cell injections are a coming attraction, although they are kind of a reality, but I say coming attraction because they're getting more and more and more popular. There are several different methods of regenerative medicine. One would be bone marrow derived, another would be adipose derived, which is fat, and a third would be amniotic derived stem cell injections. Amniotic fluid comes from consenting donors after a C-section. It goes to an FDA regulated lab. The beauty of these treatments is that it's either your own tissue or it's a tissue like amniotic fluid that is very, very safe, but you don't have any ethical issues like you used to with stem cells from embryonic origin. Comparison of long-term outcome for those with back pain and concordant discography did not demonstrate a significant difference in the outcomes, measures of pain, health status, satisfaction, based on whether the patient had surgery or not. 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain with degenerative disc disease and avoid surgery. The top non-operative pain management in Chicago is through the Premier Pain Specialists. There are 7 clinics throughout the metropolitan area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, fellowship-trained, and award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you for watching.